My name is Nancy. I'm going to be the nurse taking care of you today. How are you feeling today? So Mr. Williams tells me he's feeling fine. And I ask him, I tell him that I'm here to give you your breathing treatment. And he's agreeable to that. So I have already done my first 2 checks of my medication checks. And now that I'm in the room, I'm going to do my 3rd check. And so I'm going to start my check by identifying the patient. So I ask him, sir, can you please tell me your name and date of birth? He tells me his name is DeAndre Williams and his date of birth is 12/12/19XX, which I verify on the name band. I scan the band. I also look at his EMR, the medication administration record, and I verify it says DeAndre Williams and his date of birth is 12/12/19XX. And I ask my patient, sir, do you have any allergies? And he tells me no, he has no allergies. I verify that on the MAR. Now I am going to check my medication. So I start with his name, DeAndre Williams, and the medication that I have is ipratropium bromide and albuterol sulfate. And the doses are 0.5 milligrams and 3 milligrams in this 3 milliliter vial. And he is going to give this 4 times a day. And right now he's going to get his 9 o'clock dose because it's 9 in the morning. And I'm going to scan this medication. So now I have finished my 3rd check and I'm ready to administer the medication. So I start administration by getting the nebulizer mask, and I have to take the top part off of the bottom part. So I'm left here with this little cup and with a little center spot right here where the oxygen or the air flows. And so I open this is a little plastic vial. I open this by twisting the top and by squirting the fluid in here into the cup. It goes into the cup until it's all in there. Make sure you get all the medicine in. Make sure you hold it upright so it doesn't spill. Put the mask back on. Make sure you click it into place. It turns into place. And now I have 2 options for setting this up to get the medication aerosolized or up into the air. One is to use a machine like this. This is what they use in long-term care or in subacute rehab and in people's homes. Many people have a machine like this at home. This machine, you hook your tubing here and you turn the machine on. As soon as you see the medicine, the fog basically of the medicine, then it is ready for you to put it onto your patient's face. So this is one option for giving the nebulized medication, is to use this machine. In the hospital, they usually do not have these machines, so instead they actually hook it up right to the oxygen flow meter. Remember, your oxygen flow meter is always green. Here in Harper Hospital, we use the medical air to simulate oxygen. So I would hook up my tubing here, and I would turn my flow meter up until I see that mist. So I don't know on the camera if you can see the mist or not. I can see it. I know my medicine is ready to be being delivered. I put the mask on my patient, making sure it's covering his nose and the mask is under his chin. And I instruct my patient while they are getting this medicine, takes a nice slow, deep breath to try to get that medicine down into the lungs. As the medicine is being delivered, sometimes you'll notice a lot of drops collect right here. And so what you can do is just give that a little tap and make sure that the fluid, the liquid is on the bottom, so it'll all be aerosolized and the patient will actually receive their required dose of the medication. For how long this takes depends on the medication and the volume of the medication. So this was 3 milliliters. It'll probably take about 10 or 15 minutes. Sometimes patients get several different medicines all together. It might take 20 minutes. It depends on the medication, depends on how quickly it's being delivered to the patient. Once this is all completed, you can remove the mask and you can remove this and you can store it away, and it's ready to be used again for the next time. The mask can be reused as many times as you need to in order to give the medication. Make sure that you assess your patient before giving the medicine and also after giving the medicine, and document any changes. And that's all for administrative